Welcome to our media partners today. We're going to get rolling in just a minute. Just for you all, just to remind you to use the raise your hand function for asking questions today. After Dr. Duchen provides his remarks, we're glad that you're joining us to hear an update on the data and where we are with the pandemic. Also, just want to remind you for media that down at the bottom of the screen, you can click on the interpretation, the little globe, and you can select English or Spanish. So good morning. Welcome, everybody. My name is Sharon Bogan. I'm here with Public Health Seattle and King County. We're glad you're here with us today. For our media partners who are listening in Spanish, se puede seleccionar el globo a la parte inferior de su pantalla. Muchas gracias. We're here today with Dr. Duchen to talk a little bit about the state of the pandemic here locally in King County. And with that, I'll go ahead and turn it back over directly to you, Jeff.
Thank you, Sharon. Thank you, everyone, for joining us this morning. I'll provide, as usual, a brief update on the numbers and a few thoughts, and then we'll have time for your questions. So as of this morning, there are 36,797 cases, 2,901 hospitalizations, and 834 deaths in King County since the outbreak was recognized in February. For the past 7 weeks or so, COVID-19 cases have been increasing in King County, regionally, and across the country. We reached a new peak with 581 new cases reported on average each day last week, which is 7.5 times higher than what we were seeing in late September, and about 200% higher than our previous peak in daily cases. Our 14-day incidence rate is approximately 300 per 100,000. This amount of cases has overloaded both the public health case and contact investigation team, our outbreak investigation team, and many of our colleagues in the community who are working on the front lines to manage COVID cases in various places around the county. Testing is up by 22% from a month ago and at an all-time high. Over 65,000 King County residents were tested the week of November 8th. And we continue to encourage anyone with symptoms of COVID-19 or who has been exposed to someone with COVID-19 to isolate themselves or quarantine if you've been exposed, and to get tested as soon as possible. Along with the increase in testing, we've been seeing increasing positivity rates from approximately 2% in September to 7% recently. And this is consistent with our cases reflecting an increase in transmission, not just more testing. And as reported earlier, our highest positivity rates are occurring in South and Southeast King County. We're seeing increases among most ages, least so at the extremes and the very youngest and very oldest community members. Mostly we're seeing cases in young and working age adults. 70% of our cases are between 20 and 60 years of age. The last estimate for our effective reproductive number was 1.4 from the 4th of November, and this reinforces the fact that our outbreak continues to grow. And as the size of the outbreak grows, the magnitude of that growth and the implications of that growth become ever greater. Hospitalizations have risen by 50% over the preceding week for each of the last 2 weeks. There were 140 hospitalizations identified in this week, and this is compared to the low 50s per week during most of November. There are now approximately 250 confirmed and suspected patients in King County hospitals, compared with approximately 100 for most of September and October. Our hospital systems are stretched, and they've activated their emergency response mechanisms to manage increasing surge of COVID-19 patients. I'm happy to report that we have still not seen a large bump in death counts. They remain stable, and the median age remains around 80 years of age. It's important to note, though, there's typically a 3-week lag between when we see an increase in cases and an increase in deaths. We continue to see the previously described health disparities from COVID-19 disproportionately impacting communities of color in South King County and along the I-5 corridor. Now, we know that many cases of COVID-19 are related to socializing and to community activities and to travel, to gatherings with friends and family, dinner parties, weddings, social events, other celebrations, Halloween parties, even faith-based activities. The risk of acquiring COVID-19 today is higher now than it has ever been locally and in many parts of the country. Every day that we as individuals put off taking the necessary actions to stop the spread of COVID-19 leads to additional preventable suffering and economic pain. COVID-19 will continue to spread to more people in our community with underlying health conditions and to older adults who are at higher risk for severe illness and death, leading to increasing hospitalizations and deaths and the overload of our healthcare system. Across the country, we're seeing surges in serious illnesses that are stressing hospitals. I'm increasingly concerned about the impact on our own hospitals and our healthcare workers' ability to provide necessary and life-saving healthcare to all people who need it. Now, it's important to understand that although indoor locations where people gather without masks are clearly recognized as high-risk settings for COVID transmission, it's important for everyone to understand that restrictions on restaurants, taverns, and indoor gyms alone will not be enough to turn this outbreak around. We all need to stop social gatherings with people outside the household, people we don't live with for the time being. And this means friends and relatives alike, anyone who doesn't live in your home. We need to limit our activities and our exposure to others as much as possible in all aspects of our lives. The upcoming holiday season greatly adds to the risk and to the importance of taking action now. If people travel or gather for Thanksgiving celebrations or other get-togethers, we could see an explosion in COVID-19 causing human suffering unlike anything we've experienced in modern times. I want to remind everyone again that we can do the things we need to do when we work together and we do them safer, smaller, and smarter. Both our personal health and the health of our economy will improve to the extent that we can stop the spread of this virus. Managing COVID-19 requires long-term changes in the way we go about our lives to protect ourselves, our family members, our friends, and our community. And we've had some preliminary, very good news recently on the vaccine front that can help us get the outbreak under control over time. So there's light at the end of the tunnel. But first, we need to get through the next few months. We know what works to stop the spread of COVID-19. Our actions as individuals and as a community will determine the course of our outbreak. We need to come together during this very difficult time and work together to support and protect one another. We don't have to follow the pathway to pain that so many other communities are experiencing. We have time to change course, but we've gone too far down this pathway for my comfort already. Remember that you can't tell who has COVID-19 by looking at them. COVID-19 spreads from people before they look or feel ill. We need to expect it everywhere. Expect it where we don't expect it. We need to do better limiting the number of activities outside the home with people that don't live in our homes. We need to limit the number and duration of contacts with others in every aspect of our lives, and we need to avoid crowded indoor settings. We know that COVID spreads readily indoors, especially in closed spaces without good ventilation and with longer times spent together, and when masks are not worn. Mask use is especially important indoors, even when 6 feet of distance can be maintained, and the mask should be well made and fit well. And please pay attention to ventilation, opening windows and doors whenever possible. Hand washing and sanitizing remains important, along with cleaning frequently touched surfaces. And I also want to let everyone know that in addition to taking actions in our personal lives and restricting our social activities, it's important for our workplaces to reevaluate their COVID prevention safety measures, that they are in compliance with the directives in the governor's proclamations around workplace safety, and take every possible step to decrease the risk of COVID transmission in our workplaces. And with that, I will be happy to take questions.
Thank you, Dr. Duchin. Let's start with Allison Grande. Please say the name of your news agency. You are unmuted.
Hi, Dr. Duchen. Sorry about that. Yesterday at the Board of Health meeting, you expressed concern about King County being ready for the distribution of the vaccine when it becomes available. What needs to happen from the state level to help King County? What needs to happen in King County?
Well, thank you for the question. As I mentioned, there are 2 vaccines that are still in clinical trials that are preparing to submit data to the FDA's review process, which is an independent advisory committee of experts who will evaluate that data, make recommendations to the FDA. That same data will then be reviewed by a separate independent advisory committee of experts for the Advisory Committee of Immunization Practices. And if they are indeed as effective as they have been described, which is as effective as any vaccine that we use, 95% is unbelievably effective. It's up there with our measles vaccine, which is our most effective vaccine. If that pans out, and if the safety profile is as described, we will have very powerful tools to limit both personal illness and protect the health of our community. What happened was, or what is happening, is that there's been a tremendous investment in the development of these vaccines for good reasons through Operation Warp Speed. But I feel that it's more Operation Status Quo with respect to preparing state and local health departments to get the vaccine implementation plans in place and to make the optimal use of this available vaccine. So the first thing that needs to happen, the most important thing, is we need federal resources flowing down to state and local health departments to build the capacity to get this vaccine out as rapidly as possible if and when it becomes approved. We are planning very actively with the state. All states across the country have been directed by the CDC to develop COVID vaccine allocation, prioritization, and implementation plans, and that's being led by our colleagues at the state health departments across the country. We are working closely with them and participating in that planning process. But we will do everything possible to get this vaccine out to all who are eligible in the right order, according to risk and ethical principles, no matter what happens. But we could greatly use resources from the federal administration to at every level of the public health system to help us do that more quickly and more effectively.
Is there concern about refrigeration? Is that part of the distribution concern?
Well, for one of the 2 vaccines, it has to be stored at what's called ultra cold temperatures, which require specialized freezers that are not commonly found in many healthcare settings. So there's a limited number. We don't feel like there's a shortage of those freezers necessarily. That's not a rate limiting step at the moment. But that is a complication because you can't deliver a vaccine that requires storage at ultra cold temperatures everywhere across the country in all communities, especially if there are none of those freezers around. I believe we'll have enough of those freezers in King County to allow us to distribute that particular vaccine product. But in some communities across the country, that will be a real challenge, particularly in more rural areas.
Thank you, Dr. Duchin. Nick Popham, you can go ahead with your question.
Can you hear me?
Yes.
Okay, good deal. Sorry about that. So I had a quick question about testing capacity. We're seeing long lines at all the facilities around here in King County. Are there any concerns with testing capacity? I know the governor's executive order says if you gather people, quarantine for 7 days and make sure you have a negative COVID test, whereas other officials have said only get a test if you've been exposed or have symptoms, things like that. It seems like there's, I guess, a little bit of mixed messaging. Can you elaborate on kind of your thoughts on both those messages and then testing capacity in general?
Absolutely. So with respect to the messages, priority has always been that if you're ill with COVID-19 symptoms, if you've been around someone with COVID-19 or you suspect you've been around someone with COVID-19, those people are the top priorities for testing. We do not encourage people to travel right now. We're asking people to refrain from traveling and from having social gatherings and family gatherings. And we don't want people requesting testing for that purpose explicitly. And if we need to prioritize testing, it will clearly go to those people who have symptoms and who have been exposed, and not to people who are desiring testing for social events or for family gatherings. At this point, our capacity is adequate in the county, but we are seeing increasing demand with long lines and longer wait times. And we're working very actively to bring on new testing sites as quickly as possible. We are very concerned that if this outbreak continues to expand, or during the winter season, other viruses, influenza and other viruses will cause people to have symptoms that will also lead them to seek testing. We'll see increasing strain on our testing sites, not only here in King County and Washington State, but around the country. That can also lead to problems with our laboratories having enough supplies and reagents to do the tests. So we definitely do not want to encourage people to seek testing for social gathering purposes or for holiday gathering purposes. We want to encourage people not to gather, not to do these gatherings. The safest thing is to stay within your household members, the people you live with. Just this season, just for these next few months, the measures are tough. We have to endure them to get the larger gain of preserving the health of our loved ones in our community.
Thank you. Jasmine McIntyre, you're unmuted.
Hey, thank you. Jasmine McIntyre here. Thank you, Dr. Duchen. When it comes to contact tracing, specifically following, and I'm with Q13 Fox. Sorry, I forgot that I was supposed to say that. When it comes to contact tracing, specifically following the holidays, such as Thanksgiving, is there a plan? How many more resources are allocated towards it? And also, sorry, this is triple barreled. I don't know if I get a follow-up. How can you encourage those to be forthcoming if they might be hesitant to tell the truth because they broke the rules?
Right. So contact tracing is very strained right now, both in King County and at the state level, and this is happening everywhere. The explosion in cases, there's the issue of exponential growth, which means that the proportion with which an outbreak grows, the degree to which it grows, is related to its size. So the bigger it gets, the faster it grows larger and larger. And these outbreaks grow so quickly, they overwhelm many of our public health response capacities, both for contact tracing and to do investigations in a timely way. So we have to prioritize. So we will be looking at prioritizing our contact investigations towards people who are at high risk, towards high-risk congregate settings, and potentially less hands-on touches and personal contact with what would appear to be isolated or low-risk scenarios. But it's very difficult to develop these strategies of limited resources. So we're also bringing on as fast as we can and training as fast as we can new contact tracers, both at the state and local level. What was the other part of your question? Did I miss something?
How can we communicate with people to be forthcoming?
It's a challenge. I mean, we know already that people don't tell us everything. They don't want to tell us something that's going to get their friends in trouble. The person who hosted the party, they don't want to mention that person's name. They'll tell us they were at a party with 10, 15, 30, 50 others, but they won't. And they'll even say some of those people have COVID. They've gotten COVID after the party, but they won't want to talk to us about who hosted the party. They don't want to get the host in trouble. They don't want to get their friends in trouble. They don't want to get their favorite restaurant in trouble or their gym owner in trouble. This is being seen throughout the country. It's an understandable human nature. I don't know what we can do to impact people's willingness to be more forthcoming. I mean, clearly, the more we understand where transmission is occurring with more precision and clarity, the more we can get messages out to people about where things are happening and potentially do better case and contact follow-up. It's very difficult, and we've had instance after instance where we find out from one or more members of a group gathering or an activity or a faith-based gathering that there's been a number of COVID cases, but that they are not really willing to talk to us in detail about the circumstances. So I don't have a solution for this. I think it's something that's always challenging in case and contact investigations, but with COVID, there seems to be a particular amount of reluctance to share information by some people.
And are there any numbers on the amount of resources you're allocating for post-Thanksgiving contact tracing?
There are. I don't have them off the top of my head, but I think we can follow up with you about what our plans are to train and expand our contact tracing team.
Thank you. Esme Jimenez, you're unmuted.
Hi there. I was curious if we have any patterns about where this is happening, if there are any hotspots specifically in King County or any populations that you know of who are being especially hit.
Yeah, thank you for the question. Well, the patterns that we've been observing throughout the course of the outbreak are holding. The degree of transmission has been highest in South King County, communities along the I-5 corridor, Auburn, Federal Way, Renton, Tukwila, Des Moines, and then Southeast King County as well. Those patterns, all those same communities that have been disproportionately affected with more cases and higher rates of hospitalization since the beginning, are still, what you might call hotspots. But the disease is widespread, and the increases are widespread, affecting all areas of the county, not just those communities in South and Southeast King County. So we see increase of cases everywhere. The types of activities and the risk factors that we've seen are holding steady as well. Household transmission is very big. Of course, the question is, where does the first person in the household get it? That comes home with COVID. That's frequently workplace transmission, essential workers often, or through social and community-based activities. And this encompasses a wide range of things that we are doing that we shouldn't be doing right now in the context of a serious COVID-19 outbreak. These are dinner parties, weddings, even funerals with large numbers of people who come close in contact and don't wear masks, faith-based gatherings, lots of socializing and social networks of friends who have parties with one another, different hosts sometimes, getting together for Halloween. We know people are planning Thanksgiving, and we hope they reconsider their plans and only do that with their household members who live in the home. but many types of things that we do that bring us in contact with one another in the community provide an opportunity for this virus to spread. And as you can see, you know, the activity levels, the traffic patterns, the number of people out and about in the community looks just like normal life right now. And that is why we are seeing so many people come down with this infection. We have really slipped and fallen back on the types of measures that we need to take as individuals to keep ourselves healthy and prevent transmission. There's just way too much contact going on in every area of our lives. And there's not any one, you know, sort of area that stands out as other than socializing and social gathering, recreational, community-based activities. And within that, there's a wide range of things that people are doing that are leading to transmission.
Thank you for that. And then if I may, I was curious, what will you be missing about Thanksgiving and what will you be doing personally at home?
Well, unfortunately, my mom is on the East Coast. I haven't seen her in almost a year now. She's 92. She's living alone, but thankfully there are other people in her building that she, you know, can see and talk to. My sisters in her community, but typically I would either have Thanksgiving with my family, which would include my 2 children who are adult children who I won't be seeing. So what we're planning, my wife and I are planning to have, you know, in-home Thanksgiving. We're thinking of potentially, if we can do it outdoors, having my 1 or 2 children over for a well-separated outdoor event. But that's unlikely, you know, given our weather. We're thinking of preparing food for my daughter and my son and let them take it back to their homes and they can share it with their household members. But we won't be traveling, and I hope nobody's traveling. Travel alone presents many risks for COVID transmission, and you can bring COVID back and result in, you know, even more cases than we're already seeing. So yeah, that's my Thanksgiving plan for this year. And I'm just hoping that by minimizing the risk to one another and limiting our Thanksgiving and having a small in-house Thanksgiving this year, everybody will be healthy and alive next year to have an in-person Thanksgiving like we always do.
Thank you, Jeff, for sharing. I think we have time for one more question. Hannah Weinberger, go ahead.
Hi. Thank you so much. Crosscut.
Hannah, I think your audio isn't great. One more time.
I was wondering if you have an update on how many of the healthcare providers that have applied to be able to be vaccine administration centers are in King County, and then also what the team at Public Health looks like in terms of you know, the number of people that you're trying to bring on or deploying for vaccine distribution and planning.
Mm-hmm. Thank you I think I understood your questions. How many King County healthcare providers are signed up to be COVID vaccine vaccinators, and how large is our team at King County currently? The state is doing the onboarding of vaccine sites and vaccine providers, so you need to check with them. I haven't seen or heard any recent numbers for King County. I know this is in process currently, so it's not finished. We don't know the final number at this point, but the state has been reaching out to hospitals and healthcare systems to get them signed up. With respect to our team at the county, we have, I would say, 3 people right now who are working on planning, and that planning team is preparing a report that will specify how many people we think we need to do the implementation. And I expect that by the end of the day today. So I will be able to give you a better answer for how many people we think we need to do this work in the county. And some of this is a little bit unsettled right now because we're still working out the final roles and responsibilities between the county and the state. But most of the planning work was clearly delegated to the state by the CDC. This is nationwide. And so because we have long-standing relationships with our community at the county level, with our healthcare providers, and we know that they'll be looking to us to answer questions. We know that we will need a team, a robust team in the county also to both help with the rollout of the vaccine and to answer questions as the vaccines become available. Different formulations will undoubtedly lead to questions from healthcare providers, and we assume a large number of questions from the public as well about where they can get vaccinated and who's eligible for which vaccine and so on. So we'll need a pretty robust team to be able to manage that work in a timely fashion. And hopefully by next week we can share with you, some outline of what we think is necessary.
Thank you. So we are coming to the end of our time. I want to turn it back over to you, Dr. Duchin, to see if you have any final words. And in your closing comments, we did get a couple questions through our Facebook Live asking just for your thoughts around some of the school districts that are looking at reopening at the beginning of December, and any thoughts on that as you close up.
Well, okay, so with respect to school districts, there's obviously the more COVID transmission there is in the community, the more challenging it makes to bring people together for any reason. That said, it's turning out that schools don't appear to be a very high risk area compared to other types of places where people gathered. We haven't seen reports of large numbers of outbreaks attributable to in-person schooling in those communities that have tried it. Now, of course, in most parts of the country, it's being done in a very limited way. And if it can be done safely and slowly, and the community values that as an essential service, like we do some other essential businesses, I think it's reasonable for schools, if their community, their parents, the staff, and the administration believe that that's an important thing to do, and that the distance learning is not meeting the needs of the students. I think it's reasonable for them to try and start with the very young learners and the students who need special needs and have to be in school for that purpose. But it will be more challenging now. They'll need to be meticulous about the precautions that they take. And of course, if we see any signs of transmission that is not able to be nipped in the bud very quickly, and that spreads to students or staff, then they would have to reconsider. We're not asking schools that are currently in session and doing well with small numbers of students cohorted with safety precautions to stop. But again, everyone should understand that with the high rates of transmission we have in the community now, the risk of parents, of household members, of staff, of everyone being exposed to COVID and bringing it into that school setting is much higher than it's ever been. So we need to be prepared for that. With respect to closing words, I just can't emphasize enough the importance of understanding the magnitude of the threat that we're facing and the need for all of us to step up and take action now to protect our community. This outbreak can continue to grow to a very unmanageable degree if we let it, but we don't have to do that. We can take the steps that we know work, bring down the number of cases, bring down the number of hospitalizations, minimize the number of deaths that we will see from this disease, and then move forward again in a more measured and safe way. We just went way too fast. We did way too much. And we did not face the reality of this epidemic in the way that we should have and could have. And I think we have no choice but to do better. And I hope everyone will join me in doing everything possible to minimize your contact with other people in the community at this time and help us bring this down to a manageable level once again. So thank you, and look forward to talking with you again next week.
Thank you all for joining us today. Have a very safe weekend.